Hi, I'm Dr. Greg Relo with Express Dentist. I'm here to talk to you a little bit today about a pediatric dentist. So, a family dentist or a general dentist can provide care for the entire family, usually very effectively, but sometimes our little people need a specialist, and pediatric dentists are trained to work with young children and some of the unique considerations and conditions that come up with them. So a pediatric dentist goes to dental school for 4 years after they've done their undergraduate work, but then they go on to a couple more years of specialty work, and they deal with kids all the way down to the very youngest and up through the teen years if needed. And so they can provide, again, a very unique set of skills. You might be surprised to find out that cavities have actually declined pretty significantly over the last 30 or 40 years. But in very young children, like 2 to 5 years old, the incidence of cavities has actually increased. And so it's the most common childhood disease. It's even more common than asthma or the common cold. And 1 in 3 third graders actually have untreated cavities. So there's really, a need, whether it's with a general dentist or with a pediatric dentist, that kids have access to comprehensive care. And that can include everything from exams and management of certain types of gum disease and counseling really for the parents a lot of times. Sometimes the visits to the pediatric dentist is as much for the parents as it is for the child themselves. And then there's things such as the use of a pacifier or binky, so to speak, or thumb sucking. All of these things can actually move teeth and influence the way the jaw grows, and that can be fairly significant. And then there's always the risk of accidents with kids, some type of trauma, and that can be traumatic in itself just to manage a child that's been through that type of an accident. So children should really plan to see a dentist, either a pediatric dentist or a general dentist, by the time the first tooth appears, which could easily be around 6 months of age and usually by at least 1 year of age. And they should have checkups really every couple of years. But every child is unique, and it's good to discuss that with the doctor to see what makes the most sense for a particular child. So pediatric dental emergencies are some of the most significant reasons that a visit may be needed, and usually when this happens, it's traumatic not just on the child but on the parent as well. But if a child has a toothache, they've had sensitivity or complaining of discomfort, of course, some type of trauma, teeth get hit, knocked loose, or you're not sure if the teeth are coming in right, there's concerns about something you see in the gums, or there's fillings that have fallen out. These are all reasons that you may want to get in to see a pediatric dentist fairly quickly. So parents often have many questions, many good questions, and just a few to consider. What do you do if your child knocks out their tooth? This is truly a dental emergency, and time is of the essence when this occurs. And usually you want to try to get this tooth back in place no later than an hour. So if it comes out, you want to not hold on to the root, but take the crown of the tooth, the top of the tooth, rinse it. If it's a permanent tooth, ideally place it back in the socket and just support it there, but that may not be possible. So in that case, you may put it in some milk and try to get to the dentist just as quickly as possible. And how do we prevent cavities in children? Of course, brushing and flossing, and that can be hard sometimes to establish those habits with our young people, but also watching diet, especially before bedtime. A lot of kids that go to bed with a bottle or drink juice, those are all solutions that can actually cause more tooth decay. And when should you start brushing a baby's teeth? As soon as you can. So as soon as that first tooth comes in, just getting a little soft brush on that tooth. And if you can't do that, even a washcloth can be helpful just to wipe off those first teeth, but it's a good habit to establish. Parents want to know if dental x-rays are safe for their children. Yes, when they're used judiciously, and especially with today's technology, many pediatric dentists are using digital x-rays, and digital x-rays are 90% less radiation than the old style of of x-rays. And so when they're used just periodically, they can actually be very, very important. And how do I protect my child's teeth from being traumatized or knocked out? This happens most commonly during sporting events. So a mouth guard is very, very important to wear. There are some ready-made ones that you can get from the store and form, and then there are some that a pediatric dentist could help you with and get a custom one. But if your child's in any type of contact sport, highly recommended. Parents want to know, does my child need fluoride supplements? In most cases, no. It really depends on where you live and what they're exposed to, but we have fluoride-containing toothpaste. Many water sources have fluoride in them. Even private wells can have fluoride in them, and it's a good idea to have your water tested for fluoride if you're on a well to see, if there is fluoride in that water. And this is a good question to ask a pediatric dentist. And what kind of diet should I give my child? What's best for the teeth? Just the same diet that's healthy for the rest of the body is usually healthy for the teeth. And so really what we want to try to avoid are refined sugars, corn syrup, and sticky fruits, sticky carbohydrates, even crackers, cereals, things that stick to the teeth that provide a sugar source to bacteria in the mouth. That is often what causes cavities, so you want to be very careful with that. So if you're in need of dental care for your growing family, for your children, we can help you with that, of course. We have a trusted network of general dentists and specialists, including pediatric dentists, that we can help you. If you call our hotline, reach out to us. We'll help you find someone that fits your family and your needs in your area. So take care of those little people as they grow, and help them learn the right habits and start life with good dental health, and it will serve them throughout their lifetimes very, very well. Thank you, and take care.